Hi, my name is Cynthia Spencer, a student nurse, and I'm going to be, in this video, I'm going to be performing how to prepare an unoccupied bed. So, of course, first and foremost, I would perform hand hygiene. And then I would come in and I would prepare my supplies. My supplies are going to be by my bedside table, which in this case is my chair. And I'm going to have my sheets in the order in which I'm going to be placing them on my bed. So first, when I come in, I want to make sure that there aren't any spills. I also want to raise the bed and lower the rails so that I can prepare the bed. And I'm going to go ahead and apply my gloves so that I can take off the dirty linen. Of course, if the main blanket, the top blanket, isn't dirty or soiled, I'm going to go ahead and fold it and place it on the chair in order to be reused. Now, what I'm going to do is I'm going to remove the two sheets that are on the bed, whether it's a fitted sheet and a flat sheet or two flat sheets. But before I do, I want to make sure that I take off the pillowcase from the pillow without shaking the pillow in any way. And place the pillow to the side. And I'm going to remove the sheets. In this case, my bed only has one, but of course in the hospital or in the nursing home it would have two. I want to roll it up and make sure that I keep the linen far from my body to prevent any spread of contamination. And I'm going to put this in the dirty linen bin. Now that the bed is clear, I will perform hygiene for the bed. So I will wipe the bed down with antibacterial wipes. And then I will dispose of my gloves. Now to begin, in this case, I am going to be using two flat sheets. So for the first flat sheet, I'm going to place it in the center. And I'm going to make sure to extend it all across the bed. And I'm going to go ahead and fan fold the sheet. In order to extend it towards the end of the bed. And I'm going to make sure that every corner of the bed is reached. And in this case, I'm going to pull it down a little bit because I want to make sure. I know that in a real hospital or nursing home setting, I would be able to have access to the other side of the bed, in which I would also perform this on the other side. But for demonstration purposes of the skill, I'm just going to perform it on this side, given that I can't on my side of the bed. So in this case, since I can't do it on my side, we're just going to assume that I've already done it on that side. but I'm gonna go ahead and create, now that I have it a couple of inches down, I'm gonna go ahead and create a miter corner. So what I'm gonna do is I'm gonna lift the mattress and tuck the blanket underneath, or the flat sheet underneath the mattress, leaving this part extended. Yes. Leaving this part extended. Then I'm gonna lift it, and I have a corner at the, a triangle at the top and a triangle at the bottom. I'm gonna go ahead and tuck this bottom triangle. And of course this one would hang. However, because it is a bottom fitted sheet, I am gonna tuck it under. And then I'm gonna go around and tuck the rest of it. And I'm also gonna create a mitered corner on this end. Triangle. This part. Making sure that the rest of it does stay tucked under. Just gonna adjust this right here. Now that this one has been made, I'm gonna go ahead and place the waterproof pad on there. Of course, I'm also gonna fan fold it halfway. This way, sorry. Halfway this way. And then I'm also gonna put the second flat sheet on top. And extend this. Leave this here. And I am going to let this hang about 6 to 8 inches. Well, actually. Extend this. So of course in this scenario it would be given that this side has already been completed. Now before I do anything with this, I'm going to go ahead, and put on the top blanket again. Okay, so now that I have both the flat sheet and the blanket on together, I'm gonna tuck both of them under and create a miter corner with both of them together. Of course, here, once I raise it, I have my top triangle and my bottom triangle. So I'm gonna go ahead and tuck this portion. And then I'm gonna leave the triangle as such with this miter, but I'm gonna leave it like that. And I'm gonna go ahead and do that to this side. Okay. And of course, it will be assuming that I did it on the other side as well. Now that I've done that, I'm gonna go ahead and fan fold the top of the bed. With the top being ready to be extended. And I'm gonna go ahead and put the pillow on the pillowcase. I do not want to shake the pillowcase or the pillow, and I do not want to raise the pillowcase onto the pillow using my teeth or chin. So I'm going to go ahead and use a type of fan folding technique to get the pillowcase to a proper fitted size to fit my hands. And I'm gonna go ahead and grab the inside and use the outside to put my hand through the inside. And I'm gonna grab the pillow and I'm gonna work my way around it. Now that I've done that, I'm going to go ahead and pull the blanket back. And now I'm going to go ahead and perform hand hygiene and apply gloves again. And I'm gonna take my bin of soiled linen with me. Of course, in the hospital and the nursing home, I would have a bin or a container for the soiled linen. But in this case, my laundry hamper is being used, so I'm just gonna demonstrate taking it over there. And now that I've done that, I'm going to dispose of my gloves properly and perform hand hygiene. And that is how I prepare an unoccupied bed.